Again, ask your question again, please.
So, as in this case, the DNR is there, and I told the patient that okay, I will arrange a meeting with consultant.
Yeah.
So, in that case, as the consultant is the final authority of any case, so
Yes.
in that situation, is consultant has that right to reverse the DNR?
No, the doctor, once it is decided, and it is not revert. It is not revert
Because
on the request of the patient.
okay, so I stick to it, but I was a little
Yes.
confused in that.
Yeah, because this patient will shake you. Patient will challenge you also. Okay. This is from the examiner side. They are already having the knowledge how you have to deal with the candidate. Okay. Some candidates are not very much confident, so they will say might be it could be changed. So he will be looking happy. Oh, okay, so it will be changed. So it means you are in trap now. They've prepared the trap for you. Okay. So something
Oh,
should be very
okay, sir.
clear. Something should be very clear in many of the scenarios. Like in
Though
this
I have
scenario,
not changed my though I have not changed my mind in this,
yeah,
but I got little
shaken.
towards that. Yeah, second at this point when the consultant has always say in the cases, na, कि a consultant has all the right to take the
Yes.
decision. So at that point, I was little confused.
Yes, yes. So now you should not be confused in future if you have this type of scenario. Like in the
No,
last scenario,
I stick to it, but I
yes,
was having the doubt, so I'm just clearing that because I was having slight doubt, but
yeah.
I gone with my consensus and what all cases I have done earlier in that. It was once
That
DNI decided, it decided never to misuse the resources of
that is how
NHS.
that is how the role players they play with the candidates. Okay, so they want to check your knowledge, they want to check your confidence level. Okay, so we should
But
be
sir,
careful.
in this condition, I wanted to explain about other thing, but time was really running short.
Hmm.
I tried to not to be pace up, but still to complete the things, I just wanted to increase little speed. Till half,
Hmm.
I was okay. After half, I was thinking only one thing I
Yeah.
have completed and three things are left. So just to,
Okay.
is it like
You
if we doesn't complete the entire case,
yeah.
is
No
it
problem.
going to be bad remark?
No, 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 no problem. It's not no problem. It is not. They know the situation. Okay. They know sometimes the role player is playing too much, and sometimes you are giving chance him to play with you. So if you are on a right track, they consider it. It is not a problem. It is not necessary to complete whole scenario. It should be very clear to everyone. It is not necessary to complete whole scenario. If you are started very good and you are
Because
proceeding,
I was having plan to after DNR and all those things. I will explain about K will involve the multidisciplinary team, DNR and the other team members
hmm,
will provide the social support and we will provide the Macmillan nurse. But time was really not there. If I go by line by line, I have not extended any part of it, but still
yes,
time was I was finding sort of it.
some time was spent on the point when I was playing with you about the CT scan report. How you missed that one?
Yes. CT
At the
scan
time I was playing.
that I can cut short. I can say I'm really
Yes.
sorry. We have
If you had
arranged
the
such a
idea,
report.
if you would have the idea before, you could counteract with me accordingly. But I think that was the confusion with you that the CT scan, why the CT scan was not mentioned here, the CT scan was reviewed or not reviewed. So this was the confusion for you, and that cost like 1 minute, about one
Yeah. That
minute.
confusion was there because again I have gone through the scenario while explaining to you again.
Yes,
Gone through it. It is I missed it, but I written it was not no.
yes. Okay. So about the DNR, what we have to say, like it has been decided by the consultant. You have to start like if when the heart is stopping or the breathing is stopped, we are not going to resuscitate. Resuscitation means we have to compress your chest, and after compression of the chest, we want to restart the heart, and we want to your breathing should restart. And sometime in most of the time it is not successful. In some time if it is successful, your life status will not be as before. So you will be in a state like you will not know what is going on, what is going on around you. So it is known as vegetative state. So it is recommended and it is decided by the consultant that we will not do resuscitation. So this is a few points about the DNR. We can discuss this in uh, in the next sessions also. Any questions from the audience? Okay, I would like to highlight the side effects of DNR also. One, I told you, the vegetative state, the patient will be in a vegetative state, means he is not aware what is going on around him. He is not very much conscious. He is unable to move. You can be bedridden. You will be bedridden most of the situation. The second thing, you can puncture the heart, so it will cause like leaking of the air in your lung covering, that is known as pneumothorax. The another thing is it will break your ribs. Okay, so these all the side effects of uh, attempting the resuscitation. Do you have any question, the audience?
Sir, I have a question regarding the lasting power of attorney and
Yes,
living wishes.
yes.
Should we ask these things in this scenario?
It was written before, like when the scenario was a full scenario of 15 minutes up to 2022 in the previous scenario. But here it is not included now in the current scenario because we have to finish in 10 minutes everything, and it is observation based. But when you are giving, if you have good enough time and you have proceeded it nicely from the start till now, and you have reached to the position of DNR, and still you have time, then you can touch this area that you can give your lasting power of attorney to someone. And you may show your living wish, what you want to, where you want to live, and what is your living wishes. So in that condition, but now I strongly believe it is not needed.
Okay, sir. Thank you.
Welcome. Any other question?
Thank you, sir. Sir, there is one advice. It's a sincere, like
Yeah,
whenever
welcome.
anybody is performing,
Yeah,
can you judge on the basis of the 4 points you have put it,
uh,
where is the mistake? So it will be better for us to
yes.
correct ourselves in the next presentation, and marking on the basis of that, if you do, it will be help for the candidate.
Sure. This is my plan. And next time, whenever you will perform, anyone who will perform, I will give you feedback on the basis of your clinical skills. So we can start now from our your scenario, Dr. Vikash. I can give you the feedback now.
Okay, sir.
We can stop the recording. How many minutes now?